Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. In the last video, I just reminded people that even though I advocate in many cases a low-carb diet for people who are obese, I also work with all kinds of diet approaches, just about every diet approach you can think of, and I'm certainly willing to help you if you're not a low-carb dieter type person. And so I would encourage you to please come on if you think you need some help, and if you think you need medication to help you. That's exactly why I'm here, and myself and my whole staff will help you. And that kind of leads to a larger point that I've kind of touched on this before, but it bears repeating because I don't think as a society and as a medical community that we are at the place we need to be in terms of thinking about obesity and overweight and overfat and what that means. So I think there is I don't think, it's the truth. There's the common perception about weight and obesity is that it is a character flaw and that we treat it as a character flaw. And so I see this everywhere, and it's often, even in medical circles, I see this. So I saw a television program recently where they were profiling different sorts of radical diets, and they had a psychiatrist and a noted physician on the program who were bringing people up who did these different types of diets, and I think that more or less belittle the people and make them feel like that they had done something that was not recommended. And I think the premise to that sort of thinking is that you're treating the patient and the disease of obesity like it's a character flaw. And the oversight is that obesity is a disease. And I pointed this out. It's a chronic relapsing disease that needs to be managed. It's not a character flaw. And so different approaches are fine. I am for all types of approaches that reduce obesity. So if you're a person who likes doing Weight Watchers, fine, I'll work with you. I'll help you. You need medication, we'll provide it to you. If you do the zone diet, or if you do Nutrisystem, or if you're a vegetarian, if you're a vegan, whatever your scenario is, if you've got a plan to do it and you know you need some help, that's why I'm here. And I won't make you do a low-carb diet if you don't want to. And I will treat this as a disease problem, not as a character flaw, and we're going to try to help you. So until we talk again, I'll give you the tools. You give me the effort, and together we overcome obesity.